Here are some tips to ace your third and fourth year rotation. I didn't know those things, by the way, but for example, on the first day of rotation, we had a guy who brought in Krispy Kreme donuts. We were required to show up at 6 a.m. While we're there, busy, rushing to show up on time on this first day of the rotation, this medical student had time to go and buy 2 boxes of Krispy Kreme to come and smooch over the residents with food on the first day of rotation. I couldn't because first, I had no money. I had no money to invest in Krispy Kreme. I had no way of getting to that location that early, but they did. Now, here is another one. These residents will be praising the attendings. Oh, that is so nice what you're wearing. Here's another one. Talk about their children. Everybody loves to talk about their children. How many children do you have? What do they do? What are their likes and wants? Okay? Those are all the soft ways that the medical students use to get good marks, to get on the smooth, soft side on the person who will be evaluating them. If you are like me, an immigrant, a triple minority, female, Black in America, from a different culture. In my culture, we don't look straight at the eye to your superiors. You talk with your eyes downcast, and you don't interrupt. You speak when you're asked to speak. Those qualities did not help me as a medical student. It was the person who blurted out their knowledge anytime without being asked that was assumed to have it, while my reservation based on my culture kept me back. Okay, so you have to unlearn those things that in your culture were considered a sign of respect. You have to unlearn them for you to perform successfully in these spaces. You have to unlearn those things. Okay, that's one. Another one here is when you would walk through those hallways in the medical field in the hospital. As a Black medical student, I was not assumed to be a medical student. I had no way of commanding respect, of dictating, of demanding that I be given access to look at the chart. So I would be waiting and waiting and waiting for my turn. And time will be passing because I wanted to be modest, because I was taught to be patient and kind and not demanding. Nevertheless, even if I was demanding, I would find that the nurses in that space did not heed me at all. They knew you were a medical student, you were low on the totem pole. There was no need for them to do anything of value to further your education. More on that in the next video.